Hello, my name is Hikmet Schmeit, and I'm a student at the University of Southern California and first author on this paper. On behalf of our research team, I'm here to present our recently published paper on child temperament outcomes after laser surgery for twin-twin transfusion syndrome. The aim of this study was to identify differences in the childhood temperament of genetically identical twins that were exposed to different intrauterine environments caused by a prenatal condition called twin-twin transfusion syndrome, or TTTS. TTTS is defined as a severe condition that occurs in monochorionic diamniotic gestations, or pregnancies where two genetically identical twins, each with their own amniotic sac, share one placenta. Because these twins share the same placenta, they have vascular communications on the surface of this placenta that links the circulatory systems of the twins together. Most of the time, there is no problem, and both twins will share the blood supply evenly and both will grow symmetrically. However, in approximately 10% of these cases, there is preferential shunting of blood from one twin, the so-called donor fetus, to the other twin, the so-called recipient fetus, through the connecting blood vessels on the placenta itself. The unbalanced exchange of blood through these placental vascular communications between the two twins leads to in utero hypovolemia and oliguria in the donor fetus, and volume overload and polyuria in the recipient fetus. The result of TTTS is a unique opportunity for a natural experiment of prenatal effects to polar opposite physiological conditions, as these genetically identical twins share a discordant intrauterine environment that includes different hemodynamic states and nutritional availability. TTTS can be treated in utero via a surgical intervention using fetoscopic selective laser photocoagulation of the communicating vessels, thereby correcting the aberrant sharing of blood. While surgical intervention corrects the underlying pathophysiology of TTTS, there is a period of time before surgery, as well as a duration of approximately several weeks post-surgery, where the in utero environment of the identical twin pair remains discordant. This led us to hypothesize that the unique fetal environment would result in the genetically identical donor and recipient twins having different temperament scores. This hypothesis was supported by the current literature, which suggests many other relationships between perinatal factors and relevant outcomes, such as between low birth weight and negative emotional reactivity. With these prior studies in mind, we originally anticipated that the different fetal environments and growth patterns would result in significant temperament outcome differences between the twin pairs. Specifically, that the donor twin would demonstrate higher negative affectivity and surgency, as well as lower effortful control when compared to the recipient twins. In this study, our group assessed the temperament of these 85 twin pairs between the ages of 3 to 7 using the Children's Behavior Questionnaire Very Short Form, or CBQ-VSF, which utilizes the Rothbard conceptualization of temperament's 3 subscales: surgency, negative affectivity, and effortful control. Each of these subscales is defined as follows. Surgency includes items regarding activity level, sociability, and pleasure expressed in anticipation of reward or during high-intensity activities. Negative affectivity includes items regarding anger, sadness, fear, physical discomfort, and recovery from distress. Effortful control includes items regarding ability to focus attention, demonstrate satisfaction during low-intensity activities, and exercise of inhibitory control. The responses to the questionnaires returned by the parents for each twin pair were linked to the patient's chart that had been generated at the time of surgery. Demographic, surgical, and outcome variables were used in a bivariate analysis to test for differences in who did or did not respond to the survey. Next, the differences between the aggregated donor and recipient temperament scores for each subscale was tested with a pair t-test. Our team found that within the 85 twin pairs studied, there were no statistically significant score differences between donor and recipient pairs in any of the 3 analyzed subscales. The findings of this study suggest the possibilities that the transient, aberrant in utero environment created by TTTS did not have a significant clinical impact in temperament development. These findings suggest that temperamental traits developed prior to the onset of TTTS, that the physiological derangements of TTTS had a minimal or limited impact, or the sample size or measures of this study were inadequate to detect a difference between the twins. On behalf of our research team, we would like to thank you for your interest in this study.